to nurses in Newfoundland and Labrador, a promise.
Today, we're here to announce hope.
It comes in the form of incentives to keep nurses in the province, including retention bonuses, signing bonuses for casual nurses who accept some full-time jobs, a plan to reduce mandated shifts with better overtime rates, and reimbursement of licensing fees for nurses who want to come out of retirement. The government also said it will explore childcare options for nurses who work non-standard hours.
This suite will help, if nothing else, show that there is a vision and a strategy moving into the future, and that we will continue to be competitive across the country.
Across the country, hospitals are grasping for their own solutions. Staff shortages have pushed one PEI emergency center to close for the rest of the summer. In Quebec, a nurses' union says healthcare workers with serious COVID symptoms have been asked to work. That's allowed, but the union says it runs counter to public health. In Calgary, an urgent care center just announced reduced hours. And this long weekend, the Ontario Nurses Association said 25 hospitals were forced to scale back operations. That had Ontario Liberals demanding solutions from the Ford government today.
And let's bring all of them to the table and show some operational, day-to-day leadership and accountability.
The Ontario Health Ministry told CBC News it's working with partners across the health sector to address challenges on the ground, including deploying more internationally educated nurses.
They need to talk to other board of nurses in other countries that the credentials should be comparable to Canada. Like for me in the Philippines, I am a bachelor's degree, but when I passed my credentials, when it came back to me, it's non-comparable.
Experts warn hospitals across the country need solutions now to avert a crisis when fall and winter arrive.
I have not seen anything this significant, and it's awful. It's absolutely terrible.
A cry heard from coast to coast.
So, Chris, clearly this is a moment where governments across the country are looking for solutions to fix this crisis. Where did today's solutions in Newfoundland and Labrador come from?
Well, Adrienne, the government says they listened to nurses. The incentives announced today came out of a think tank assembled in April, made up of nurses who expressed what they needed to stay in their profession. And the need there is immediate. They have 600 vacancies. 900 nurses are set to retire. You can bet governments across the country are watching as they deal with their own alarming shortages. Just this afternoon, Toronto General Hospital, a major healthcare center in downtown Toronto, says its 3 intensive care units are at full capacity because of a lack of staff. Adrienne?
Extraordinary. Chris Reyes in Toronto. Thanks, Chris.
Thank you.